This program aims to find solutions to your medical queries. It seeks answers to common health problems that have been hounding you. We will help you out in finding answers to your medical concerns. I'm Angel Jacob and this is MedTalk, your weekly on-air health consultation here on the Solar News Channel.
In today's fast-paced and workaday world, people tend to give little consideration to what they eat and drink. But without careful attention given to your diet, you may develop diabetes, a growing global epidemic. Considered a serious lifelong disease, diabetes is a disorder of metabolism.
Diabetes primarily is an inherited trait. The real cause of diabetes is insulin resistance. This is the type 2 because there are two types. The type 1, very easy to diagnose because biglaan kasi yun eh. Dahil yung parang nasira ang mga gumagawa ng insulin due to antibodies. The type 2 is the most common. And it is due to insulin resistance, which can be partly inherited, but a great deal now is due to our diet and lack of exercise. Like the number one cause of insulin resistance is overweight and obesity.
According to Dr. Joey Miranda, Secretary of the American Association of Clinical Endocrinology Philippines, there were 3.4 million diabetes cases in the country in 2010. 360 million diabetics were recorded worldwide in 2011. And by 2030, the numbers are expected to rise an estimated 550 million. Doctors suggest that it is vital to get medical attention at the first sign of symptoms to prevent long-term complications such as amputation of limbs, nerve damage, heart diseases, and stroke.
I think that the Filipinos think that diabetes is primarily due to lack of insulin, first of all. And it's not the case. Because unfortunately, we are imitating, pardon me for saying, the most unhealthy diet in the world. So in other words, live a healthy lifestyle. Physically active lifestyle, healthy, balanced, just the right calorie diet. That's it.
What are the first few signs and symptoms of diabetes? What are the risk factors involved? Find out the answers tonight on MedTalk.
And joining us tonight is Dr. Cedes de la Rosa, President of the Philippine Association of Diabetes Educators. Also joining us tonight is Dr. Melanie Duran, a diabetes specialist from the Tokyo Health Link. You may join the discussion by calling our hotline at 548-4678. Good evening, doctors. Welcome to the show.
Good evening.
Tonight, it's about diabetes. We'll focus on the awareness and early diagnosis. Let's go straight into the types of diabetes. I know in the VTR we already mentioned it, but let's talk about it extensively. What are the types of diabetes?
Well, basically, there are three types, major types of diabetes. One is type 1. Most oftenly, children are affected by it, although the adults can also have it. Type 2 is what is more common right now because of insulin resistance and insulin insufficiency. And type 3, we don't call it type 3, but gestational diabetes. It's the pregnant state that brings about the diabetes. So with type 1, we don't have any risk factors or anything. It just happens. The risk factor basically is genetics. But then there are certain type 1 patients, the children, they don't have a family history as well. So one consideration could be an infection, because our body has immune system, right? So for some reason, the immune system of the body attacks the beta cells, which is the producer of insulin. So they need insulin for life to survive. And the type 2, which is common, which is insulin resistance, your body keeps on producing the insulin, but your body does not, how do you call this? Recognize your insulin. No? So, or it's insufficient, meaning they don't produce enough insulin to lower your blood sugar. Now, the third one is your gestational diabetes. The pregnant state alone brings about the diabetes, but once the mother delivers the child, the blood sugar returns back to normal.
Okay, so it's only when she's pregnant.
When she's pregnant. But the thing is, this is already a risk factor for future development of diabetes.
So we mentioned the 3 major types of diabetes. Let's go to diabetes type 1. What do people diagnosed with diabetes type 1 experience?
Because it's very abrupt, okay, they end up right away in the emergency room. They have hard of breathing, no? It's hard for them to breathe. It's very fast. And they express this breath, we call it alcoholic breath or acetone breath. Acetone breath, no? Because they develop certain chemicals, no? We call it diabetic ketoacidosis, no? It's very abrupt. More often than not, the child comes to the ER unconscious.
Why is it more common in children? You mentioned the child, just to...
Statistics show that it is more common in children, but there is no specific, what do you call this, reason why it is more common amongst children. Although we discover also genetically, if there are certain adult, especially in the elderly, that they also have type 1. So these are more often enough, they are adults who are on insulin that we thought that they needed the insulin just to control their sugar. But in the end, if we do genetic studies, we found out that they're also type 1.
Oh, okay.
Okay, so
And once we diagnose them, no, it's a high index of suspicion. When the doctor in the emergency room is highly suspicious that this might be a type 1, their blood sugar should be right away taken. And if it's very high, bingo, that's DKA or diabetic ketoacidosis. Right away, the patient should be hydrated and be given insulin.
Okay, this is for type 1.
Type 1.
Rush to the emergency room,
Yes.
and the signs and symptoms that you mentioned should be addressed immediately.
yes.
For type 2 diabetes,
Okay. For type 2 diabetes, more often than not, it has a very long asymptomatic phase. And that is the reason we have to look for risk factors. More often than not, the patients come to the doctor already with full-blown diabetes with complications. No? If we're going to tell a story,
okay,
we call it the kwentong anay. Okay? The risk factors is the nuno ng punso. Okay? And the termite travels to our house, and when the termite is already going up the beam of our front door, it becomes now the pre-diabetes. Okay. If it spreads to our house, all over our house, towards our roof, that's already full-blown diabetes with complications. So it's very important to be aware how to prevent, if you already have the risk factors, how to prevent it from going to pre-diabetes and pre-diabetes to diabetes.
so in preventing it into going to pre-diabetes and hopefully hindi na siya maging full-blown diabetes, what are what should we think of? What should we consider so that it doesn't become full-blown diabetes? Not even borderline. We don't even want it to be borderline diabetes.
Very often we advise our patients, since they have the full-blown diabetes, we ask about the family members because genetics play a very important role. So have themselves tested for diabetes. And unfortunately, not all pre-diabetics show a fasting blood sugar that is kind of abnormal. So we have a range for that. So that's between 5.5 millimoles per deciliter and 7. Because when it comes to 7, we have to retest again if the patient is diabetic. So it has to be, the pre-diabetic state is from 5.6 to 6.99.
And the endocrinologist,
We usually ask for a second exam. It's either a fasting or we use the gold standard, which is the 75 grams anhydrous glucose.
Okay.
So they challenge the pancreas with regards to its response to a high blood sugar.
these are tests
High sugars. These are tests. These
done
are
at the
laboratory.
hospital upon the recommendation
Yes.
of
Yes.
your doctor. We mentioned the signs and symptoms of type 1 diabetes. Now let's go to the signs and symptoms of type 2. Is there any evident sign, or is it something that you don't know you have?
Okay.
Yes,
So
doctor.
more often than not, when you have the following symptoms, you are already diabetic for 3 to 5 years. So number 1, you urinate very often,
Is there a certain color to the urine that you watch out?
more concentrated. Okay. Number 2, you are thirsty more often, and you lose weight without trying to lose weight.
Oh, because diabetes is a metabolic disorder. And so you lose weight without even trying, without even
Yes,
exercising
yes.
or dieting.
Yes.
Okay. It's because insulin has a lot to do with depositing whatever excess calories you have. So if your insulin is not working properly, the sugar just go out in the urine. That's why you urinate more often and lose weight in the process.
Okay. So, yes, Dr. Duran, you'd like to add?
So we hope that through this program, we should not wait until we develop those symptoms. No? We should go to the risk factors. So number 1, as long we are Asian, Pacific Islander, no? We have one risk already. If you have a first-degree relative who has diabetes type 2, you have that risk already. We're going to grow old. So if we have aging, we have 3 factors already.
We're all going to age.
Yes.
So, we're all there at number 3.
So those first 3 factors, we just have to accept. But the following, we can do a lot of things to prevent diabetes from happening. So we go to sedentary lifestyle.
Oof, okay. Sedentary meaning,
The jaw exercises a lot.
okay.
Eating.
It's this, that's the
the-
exercise
Yes.
instead of this.
It's not the whole body,
Yeah.
it's just the jaw.
Okay.
And the fingers, because of digital age,
Yes.
everything is what your fingers get to exercise, cell phones, the video games. So that's really a sedentary lifestyle. And the diet,
Okay.
high on fast food, the
Ooh.
westernization
Every-
of our diet.
Because
That's a
everyone's
very-
so busy. That's the excuse. Everyone's so busy. No time to cook. No time to prepare the meal. So the fastest
Fastest.
solution to that is
Yes,
to
and
have some fast
for
food.
us with regards to food, we have to chew our food. Because of the fast-paced lifestyle, we don't chew our food anymore. We just want to swallow. That's it. That's bad.
Okay.
So it's a risk factor, and it also leads to obesity. That's one factor.
Doctors, we have to go to a break. We'll go to a gap. When we come back, we'll talk a little bit about gestational diabetes, just a little bit about that. And we have myth busters when it comes to diabetes. More on diabetes with our doctors here on MedTalk.
Did you know that more than 1 million amputations and at least 5% of blindness each year are caused by diabetes? According to the World Diabetes Foundation, the disease is responsible for 3.5 million deaths yearly, with someone dying from diabetes-related causes every 10 seconds.
We're back here on MedTalk, still talking about diabetes. Dr. Duran, Dr. De La Rosa, we cut to the break. We were talking about the 2 types of diabetes. There's a 3rd type, which is the gestational diabetes. Please
Yes.
tell us about this.
Gestational diabetes is if you are a member of the risk, if you have a risk factor, particularly the Asians are at risk to develop diabetes. So it's the pregnant state that brings about the rise in the blood sugar. So we have to treat them either through diet or through insulin.
What is it about the pregnant woman that brings about
The
the diabetes?
There are certain we call them counter-regulatory hormones because we have to accept the fact that pregnancy brings a lot of hormonal changes. So these hormonal changes contributes a lot to the development of gestational diabetes. So one way to control this is through diet and exercise. And if the diabetes is if the blood sugar cannot be controlled by diet and exercise, that's the time we suggest insulin.
Okay,
but
it won't affect the
baby.
pregnancy, won't affect the baby.
It helps lower the sugar. So one thing about gestational diabetes is once the mother delivers the baby, the blood sugar returns to normal unless she is an undiagnosed type 2 diabetic. Because as we've mentioned earlier, type 2 diabetes has a long duration of being quiet.
Yes.
So sometimes it's the pregnant state that brings about also the diabetes, the type 2 diabetes.
So do you suggest that when one has gestational diabetes, immediately after giving birth, she be tested?
Yes.
She be retested
yes.
6 to 12 weeks
6
after.
to
So it's very important because this becomes a risk factor for future diabetes.
Okay. So it should be SOP, no?
Yes.
If you do have gestational diabetes. 6 weeks after?
6 to 12 weeks after giving birth.
You were asking why?
Yes, doctor.
Remember, the one that's keeping the pregnancy towards 9 months is the placenta.
Yes.
Right? So the placenta inside the mother's womb is the one producing the hormones that is counter to the insulin of the mother.
Oh, okay.
So once the mother delivers the placenta, the sugar goes down.
Okay, so parang it goes with it already.
Yes.
Okay, no wonder after giving birth. So
The sugar
the
returns
sugar.
to normal.
And the reason for reclassification at 6 to 12 weeks because there's a 50% chance that mother will become diabetic in the future.
So to avoid that, again, your suggestion of getting retested.
Yes.
Okay, doctors, now let's talk about the myths surrounding diabetes. Myth number 1, protein is better than carbohydrates for diabetes.
Okay.
For diabetic patients.
Yes.
Dr. Duran.
So, Angel, there's a lot of fad diet around, right?
Yes.
But we should remember to go back to a healthy eating pattern. So basically, 40% of our total caloric intake for the day should be coming from carbohydrates. Okay? Then 40% will be coming from protein. Okay. And the rest, 20%, will be coming from fat. Okay? So if you eat more of the protein, okay, your body will suffer. Okay? Your sugar might go down to abnormal levels. And the brain will sense that. You'll become dizzy, okay? So it's better to go back to the balanced diet.
And we have to remember that carbohydrates are your go foods. These are the immediate sources of your energy.
Your fuel.
Your
so to
fuel.
speak, yes.
So your proteins are part of the growing, the grow
the
food.
grow food, the glow food are
the go, grow, and
glow
glow
food.
food. So you really need carbohydrates. So when you're a diabetic, it doesn't mean that you cannot eat carbs. We just have to portion them. We have to include it in the total calorie count of the patient with diabetes. So it's just a balance of everything.
Which we are still struggling to do because,
Yes.
you know, we always say everything in moderation, but when it's in front of us, we forget moderation.
Yes.
But one thing we can't forget, we have a caller on the line. Hi, Prospero Mendez. Good evening.
Hello po. Good
Hi.
evening po.
Good evening. Yung question mo for our doctors, please go ahead.
Kasi nagpa-urinalysis ako nung November 3. Ang nakalagay po doon sa result, positive 4. Ay ano po ang ibig sabihin noon? Sa sugar ba? Sa sugar.
Positive sa sugar. Salamat. Salamat for your question.
Sige
Positive
po.
for...
Sugar ang urine.
Plus 4.
Plus 4. It simply means that yung asukal po ninyo, yung blood sugar po ninyo, is beyond the normal. Kasi yung kidneys po kasi po ninyo can only accommodate 180 milligrams per deciliter. Pag more than that, tinatapon nyo talaga po sa urine. So, kaya kayo plus 4, super high siguro po ang inyong blood sugar.
Nako, since
So,
high
pag na-control po yung blood sugar ninyo, mawawala na ho yung sugar nyo sa urine. Kaya nga there's a saying, mas alam pa ho ng langgam na diabetic kayo kasi ho, sila po yung nag-gather around dun sa ihi ninyo.
So, any suggestion for him to lower his blood
Seek
sugar?
your doctor. So, meron siyang mga gamot na ibibigay sa inyo. Tapos, diet and exercise.
Okay, so if this is the first time he's consulting, then
I think he has to seek medical advice.
okay. So, all right. So now we go to myth number 2, doctors. One has to give up refined sugar and desserts. Naku, ang hirap niyan because it's Christmas.
It's Christmas.
How do you do that at Christmas time?
Okay.
Dr.
So we
Duran?
don't have to give up refined sugar and desserts, no?
Okay.
Even the table sugar, it's allowed.
Okay.
In the-
Whatever color, because table sugar now comes in different colors. There's
Yes.
brown, there's white, and then
Yes.
there are other colors.
So we advocate that we should consult with our friendly nutritionist in order to factor in how much sugar is allowed and how much dessert we can eat. Even ice cream is allowed.
So we don't deprive ourselves naman of
Yes.
enjoying, whether it be Christmas or any other day that
Yes.
we deserve our
Yes.
desserts.
But the important thing here is we don't eat too much.
What,
Don't
what
eat
is
too much.
what is not eating too much? Let's say a cake slice. Well,
Cake slice, I think they have a specific measurement that is equivalent to what? 15 grams of carbohydrate. So the nutritionist knows this better. So we really work as a team. Basically, the team would consist of a doctor, a registered nutritionist dietitian, and a nurse educator. So all of this, all the members of the team have background in diabetes education, but we have to remember that the patient is still the driver. So even if we suggest everything to him and he doesn't follow, his blood sugar will really go up, will be uncontrolled. So, and we also teach carbohydrate counting, that's part of it. So you can have your, like for example, you can have your 1 scoop of ice cream as long as you have to remove approximately 1/2 cup of rice.
okay, so you have to choose.
You have to choose.
Can't have both.
Yes.
All right. even for those who don't have diabetes, I think it's also a good thing to choose wisely.
Yes.
When it comes to your food intake.
Yes.
Doctors? Okay, myth number 3. Artificial sweeteners are not safe for those who have been diagnosed with diabetes.
It's safe. It's safe for people with diabetes, no? Our research in diabetes has already proven that it's safe, artificial sweeteners. As long as you don't take a 1 case of sweetener.
Or in your coffee, you put like 3 or 3.
Yes, yes,
One
yes.
is enough. I guess just to
Yes,
have
yes.
that sweet taste.
Yes.
That's it.
So doctors, we have another caller on the line. Hi, Con Airoso.
Yes,
Hi,
ma'am.
Con. Good evening.
Hi. Good evening. Yes, ma'am. My question is, in the morning, I test myself with the BG strip. The result I'm getting is 126, so I guess that's already high. But in the afternoon, when I test myself again, I'm getting a range of about 80 to 86. So I think it's pretty abnormal for me to get a high in the morning and then it lowers down in the afternoon. What does that indicate?
Thank you, Con.
It depends on the medications that you're using. Because if you're on insulin and you get a reading, your before meal sugar should range between what? Around 80 to 130. That's okay.
Okay, here's just
But if-
126 to 86.
126 is the diagnostic, one of our diagnostic criteria. So when you're a diabetic and you're monitoring your blood sugar, you should the target values could be between 80 to 130. Okay, but if you test your blood sugar 2 hours after a meal, and the 2 hours should start from the time food enters your mouth. It's not the time when you fold your spoon and fork after a meal. So when you get your blood sugar 2 hours after a meal, it should be below 180. So that's the normal range. Now, with regards to your medications, the reason why you have a high sugar before breakfast and a low sugar during the day, it could be because you need to adjust your medicine. Okay, so you have to talk with your doctors. And there are some patients who don't eat at all because they're so afraid that when they eat, their sugars will go up. So that's where hypoglycemia comes in because they don't eat properly. Then there are the other side of the spectrum is they eat a lot because there's medicine.
Right.
So I don't know po if yung sa inyo po, we need to adjust your medications or we have to adjust your diet.
And also, different patients have different target goals. It depends. We have patients wherein we target the fasting blood sugar below 100. There are patients we target it up to 110. So it will be depending on your collaboration with your doctor.
Okay. Con? You're still there? Oh, okay. She put the phone down already. So thank you for that, doctors. Now we have a question from Twitter. I'm underweight. Can I also develop complications from diabetes?
So complications of diabetes doesn't depend on weight alone. It doesn't mean that if you are obese, you are more prone to complications. Or if you are underweight, you are less prone. There's no matching of that. Okay, so there's a variety of presentation of patients.
Again, the signs and symptoms that we mentioned earlier, that's what they should watch out for,
Yes,
right, doctors? Another question from Twitter. If I have type 2 diabetes and take insulin, do I have to take it for the rest of my life? This is for type 2.
It depends. Because some doctors advocate early use of insulin to let the beta cells, the one producing the insulin, to take a rest. So they get the insulin from outside. So once your blood sugar becomes normal, we can shift it to oral medications. But the most important thing there is not to forget your medicines. Just because your blood sugar is normal, it doesn't mean that you have to stop taking your medicines.
Okay.
That's the most important thing.
All right. So with type 1 as well, you have to inject for the rest
Type
of
1,
their life?
they need to inject insulin for the rest of their life. And in cases of type 1, we have what we call the honeymoon phase, wherein they need little insulin because their blood sugars are normal. But it doesn't mean that they have to stop taking their insulins.
So continuous meds. And
Continuous meds, diet, and exercise again.
Dr. Duran, you wanted to say something?
It's the nature of diabetes wherein as we grow older, our insulin production really reduces going down. No? So don't be surprised if your doctor eventually will recommend insulin because it's the best medicine for diabetes.
Okay, that I remember that was number 3. We'll all age.
Yes.
And because of that, we should be careful.
Yes.
Watch what we eat, exercise, and listen to our doctors.
Yes.
But most of our cases, most of our patients, if we start insulin very early and they become controlled very early in the game, those are the patients who live longer.
And we want that. I mean, not necessarily adding in numbers, but the quality of life.
And the quality of
So when we come back, doctors, we'll talk about the complications that can arise from diabetes, only here on MedTalk.
If you have been diagnosed with type 2 diabetes, it is suggested that you stay away from these food items since these can increase your risk of diabetes complications. The list includes high sugar foods like cookies and candies, carb-heavy potato chips, French fries, and donuts. and whole milk dairy products such as regular cheese and cream, and full-fat yogurt, since saturated fats can worsen insulin resistance. Nevertheless, it is important for you to regularly check with your doctor regarding your diet plan, so you can regulate your blood sugar level and weight at a healthy pace. For Raul Policarpio, life has never been the same after being diagnosed with diabetes at 18.
Pag inom ka ng soft drinks, lagi soft drinks. Dahil nakakauhaw nga. Nung maglalaro ako ng basketball, naramdaman ko, ba't bumabaligtad ako? Tumatakbo ako, bumabaligtad ako. Kahit maglakad ako, bumabaligtad ako. Tapos nangangayayat ako. Tapos yung nangihina ako. Napilitan akong magpa-check up. Yun, doon ko nalaman na may diabetes pala ako.
He has had a family history of diabetes, with all of his siblings suffering the same fate and his mother succumbing to the disease.
Nagpa-check up ako. Tapos tinanong ko yung doktor kung mawawala. Sabi, sobrang bata ako pa, hindi na mawawala. Pagkakain ka, tataas. Pag iinom ka ng gamot, bababa. Kaya hanggang ngayon, pagtanda ko, dala-dala ko yung pagkaroon ng diabetes.
Without proper treatment, diabetes can eventually lead to serious complications, including nerve damage, loss of limbs, kidney failure, and heart problems.
Yung pa-check up sila, pag naramdaman nilang kakaiba sila, parang naramdaman nila yung mga sintomas ko, nangyayari sa kanila, pa-check up sila at maggamot. At kumain ng tama. Huwag kakain ng sobrang matatamis.
For the 45-year-old vendor, it was blindness. Today, he has to undergo dialysis twice a week to keep other deadly complications at bay.
Nagsisisi ako dahil una nawala yung paningin ko. Bakit hindi ko tinuloy-tuloy?
What other serious complications may arise from diabetes? How can you keep diabetes under control? More of diabetes tonight on MedTalk.
Okay, welcome back to MedTalk. Doctors, our case study Raul. He was diagnosed with diabetes at 18. At 45, he lost his sight. What could have happened in all those years?
We have to remember that type 2 diabetes has a very long period of being asymptomatic. So by the time he recognized that when he had the symptoms, he had himself checked. But the thing is, he knew that he had a family history of diabetes. So early detection is very important. Okay, so when it comes to the complications, the development of complications, we relied on the study based on type 1 diabetics, because from the time of diagnosis, this type 1 diabetics develop complications 5 years after diagnosis.
Okay.
So it's very easy to predict the complications for type 1. But for type 2, some of our patients knew that they had diabetes when after a stroke or a heart attack or after their limb was amputated.
And we don't want to get to that
So we don't want to get to that stage. So if you have a family history of diabetes, have yourself checked early. Then go to your doctor, have yourself checked, and please follow their advice.
Yes, Dr. Duran.
And also, it's very critical during the first consultation. There will be a program that will be offered to the patient to prevent this from happening towards the future. No? So it's always a collaboration. After the first consultation, do we have to refer right away to the ophthalmologist? It depends on what the ophthalmologist will see on the first examination. Should he come back every 6 months? So those are very critical, the first session with your doctor. After that, should you be referred right away to the nutritionist, no? And the nurse educator? It should be part of a program. We should not go to the doctor only when we feel something, especially if we have the risk factors.
In Raul's case, just to go back to our case study, his family.
His family is already an indicator.
Yes.
So he should have gone to his doctor and have himself checked to be able to prevent these complications. Now, one sign of diabetes is blurring of vision. Why? The rise in the blood sugar makes your lenses sensitive to water. So it absorbs the water. So it's like when you're looking underwater without the goggles. So when your blood sugar is controlled, the lenses become thinner. So you have clear eyesight again. So when your blood sugar is high, we don't advise them to have their eyes refracted. Check for refraction, for error of refraction. We have to control the sugar first. Now, after that, one of the complications for the eyes could be early cataract formation. So you're still young and yet you have cataracts. And the other thing to watch out for is retinopathy. That means because of the flow of blood through the usual channels in your eye is blocked. So it has to go somewhere. So it forms new blood vessels. That's the retinopathy of diabetes.
Okay.
So that's one contribution to blindness.
And I guess that's what happened in
In
Raul's
this
case.
because of uncontrolled blood sugar.
And also, it could not stop only with the eyes. We have to check the kidneys and also the feet. So usually, they have all of them.
Okay, that's why amputations normally happen
Right.
in the feet. That's one of the one of the complications that diabetes brings about.
Because one thing we've noticed, I don't know if you do this every day after taking a bath, do you check your feet?
No, I should. Why should we check our feet
For
after?
calluses. After a bath.
Okay.
So because we have to check for calluses, for any abnormality in the bones of our feet,
Even
for
the skin.
the dryness of the skin. We have to
okay.
check for that because those become sources of infection, and because of the infection, it could lead to amputation. If it is coupled with an uncontrolled blood sugar, it could lead to an amputation.
So the checking of your feet after you take a bath, whatever time of day, is good for everybody.
Yes.
Not only for those who are.
And to wear proper shoes.
No, don't sacrifice fashion anymore for
Yes.
comfort.
Yes.
For comfort for fashion, balik
Yes.
that. Okay. Doctors, we have a caller on the line. Jules Alano. Hi, Jules. Good evening.
Good evening.
Hi, please go ahead with your question for our doctors.
Good evening.
Yes. Hi, Jules.
Yes. Doc, I would just like to ask now because right now I'm taking metformin. It was prescribed by my cardiologist. I had a checkup. He's a cardiologist at the same time an internal medicine doctor, no? So actually it started when I had twitches in my body. I started to have twitches, and I used to drink a lot and stay up late. And my blood sugar is around, sometimes it's 119, 123, 127. I had fasting blood sugar, then after that, it shoot up to 180.
Okay.
So after that, after the consultation, my doctor did not diagnose me as a diabetic. Instead, just gave me metformin to control my blood sugar. What I would like to know is because before I had several checkups in different laboratories, there are different references. There are those who give 100 as the normal, rounding 110, 120. Can you're not like regulated as to which one is really the normal. Kasi we the patients get very confused as to which one is really the correct normal value.
Okay.
Okay, thank you,
So,
Jules. Dr. Duran.
We understand your frustration and your confusion, no? But we follow international laboratory values. Okay. For the fasting blood sugar, it should be below 100. If it goes to 100 to 125, you are labeled pre-diabetes, but it has to be confirmed with another test. But once it becomes above 126 milligrams per deciliter, you are already diabetic. And you mentioned you have a 180, so that's already diabetic levels.
Okay, so there's a 119, 123, 127.
Yes.
Those are diabetic levels already.
So we use fasting blood sugar, we use 75 grams OGTT, and we also use hemoglobin A1C, as long as the machine being used is standardized. Okay, so we can use those 3 laboratory tests to know if you have diabetes or not. So sir, you can have a reassessment of your situation, get hold of a very good team of a doctor, of a nutritionist, and also a diabetes nurse educator to take good care of you.
Jules? Hello? Hi,
Hello?
Jules. Yes.
Yes. So after 2 hours, after your FPS, you're supposed to take the normal breakfast. Then after 2 hours, you're gonna have this HB1 something, HB1C something not test, and mine was 180. So it means I am already diabetic.
Okay. So you had a test of 180, right? And also 123. Now, to make sure, you can have a full meal, and then after 2 hours, if your sugar goes up above 140, between 140 to 200 or 199, you are pre-diabetic. But if it goes above 200, you are diabetic already. With the HbA1c, no need to fast. You can come to the laboratory anytime. If it's between 5.7 to 6.4%, you are pre-diabetic. If it's above or equal to 6.5%, you are diabetic.
Okay, Jules? Jules? Okay, well, thank you for calling, Jules. Thank you, doctors. That's what we want on the show for our callers and for the Twitter questions, for them to consult.
Yeah.
And to be more aware. I mean, it's always good to, sometimes you just have to vent how you feel.
Yes.
You just have to express how you feel and understand better the disease that you face. Or if you, like in Jules's case, you mentioned he's a little bit frustrated because he does want to understand if he does have diabetes, or what should he watch out for, how he could control it.
Yes. It's really good if the patient and the doctor communicate with each other, because a lot of confusion because of the different labs. They really have different reference values. So I think it is better for Jules to talk with his doctor and try to find a solution with regards to the confusion with regards to his laboratory results.
Okay, Dr. De La Rosa, Dr. Duran, we are going to come back, and when we come back, it's Christmas season. We want to enjoy all the sweets. We want to indulge. We want to try everything on the menu.
Yeah.
How do we do that if a person has been diagnosed with diabetes? We'll talk about that when MedTalk returns. That's what we wanted for them to call. We're back here on MedTalk, and we are on our final stretch in our discussion of diabetes. Before we cut to the gap, we were talking about how to enjoy the holiday goodies, holiday yummies. If you are pre-diabetic, if you have been diagnosed with diabetes, and in general, for everybody to enjoy whatever is in front of us this season?
Well, in my case, if I have a nutritionist on board, I always tell my nutritionist to teach our patients how to eat during the holiday season.
Okay.
Because, how's that? If, for example, a buffet is laid out in front of you, what I usually suggest to my patients is to look through all the food. Now, if there are certain kinds of food that they don't eat normally, try them a little at a time. Okay? Because basically what I've noticed for people who are doing the buffet rounds, they put everything on their plate. So everything becomes a mishmash. Right? So what I tell them is to put space in between the plates, in between the food.
Okay.
So if we follow the healthy plate, so 1/2 of your plate should be vegetables. Then 1/4 should be your carbohydrate. It could be pasta, it could be rice. Then the other 1/4, we advise them to choose between fish or chicken.
Okay.
White meat, no balat, not fried.
That's the good part. Okay.
So that's what that's what I normally advise my patients, and not to graze. Because if what they do is just they eat portions from other people's plate, they don't know the exact amount that they're taking in.
Correct.
And as much as possible, if you have to drink alcohol because it's a party, you have to limit yourself to what? 1 bottle of beer, 1 glass of red wine, or 1 shot of liquor. And nurse it all throughout the night.
But during the holidays, your parties are every night.
Okay, so the bottom line is spacing.
Okay.
And plan your activity also in between.
Yes.
If you can insert walking in between the eating, you will burn the calories you have taken in.
So instead of saying, can you please get me some, why don't you stand up and go to
Yes.
the buffet table?
Yes.
What's a little walk?
Yes.
That's right, doctor.
Yes, that's correct.
But you mentioned the portion size of
Yes.
your chicken, or the fish, chicken
Yes.
or fish. How about the beef and the pork?
Beef and pork, we, like what our mentor always says, bawal ang 4 na paa.
Ay.
Kasi animal fat, it contributes a lot. It contributes to cholesterol also.
Even if it's organic?
Same.
4 na paa na organic, it's still 4 na paa.
Yes,
Yes.
right.
Okay.
So, I think a lot of beef eaters and
Yeah, I
pork
included.
eaters. No, but we also tell them, because we advise our patients, as what we've mentioned earlier, we tend to get what our patients normally eat to avoid binging. So I think one thing to do during the holiday season is not to binge. You tend to deprive yourself. Then when everybody's not watching, you eat a lot of the things that you deprive yourself of. So that's what we want to avoid. So you can still eat, like you can still have your ice cream, you can still have your fruit salad, but everything in proportion, in moderation.
Okay, thank you, doctor. Now we have a caller on the line, Lydia Lim. Hi, Lydia. Good evening.
Yes. Hi, good evening, ma'am.
Good evening. Yung
Yes.
question niyo po for our doctors.
May problem, hello. Good evening, Doctor.
Opo, good evening.
Okay. Ang problema ko, ma'am, is 2 years na ako, almost 3 years na ako may diabetes type 2. Ngayon, nagtitake ako ng Gluconel. Last August 12, ang SGEIC ko is 7.9. Tapos kanina umaga uli, dahil follow-up check-up ko sa cardio ko, kasi may sakit ako sa puso na ischemia. 9.2 kanina umaga. Tapos at the same time, nag-hold abdomen ako kasi masyado, laging nagbablated ang stomach ko. Na kunting kain ko lang, para bang dito sa abdomen ko, laging yung matigas siya. Ngayon, tapos 2 years na rin ako na, yung numbness na parang mainistisa yung paa ko. Yun ang problema ko, at saka yung aking mga fingers may numbness. Ang tinitake ako ng vitamin B complex at saka yung Gluconel for my diabetes. Yun po ang tinitake ko everyday. At saka yung dietitian ko sa puso ko, kaya hindi ko alam kung bakit nagpa-fluctuate yung aking blood sugar.
Salamat, Lydia.
Yung po sa mga nararamdaman ninyo yung sa paa po ninyo, at saka yung sa pagiging parang ang sabi ninyo po, parang tumitigas ang tiyan pagkatapos kumain. It could be one of the signs na neuropathy po ang tawag natin. Kasi meron kaming tinatawag na gastropathy. So may mga gamot din kaming nabibigay para makatulong po ito. So kumbaga, ang mga diabetic po kasi, may iba, ang panunaw, hindi ho maganda. So, pwedeng ganun po ang nangyayari po sa inyo. So, sa tingin ko, kailangan nyo bumalik din po ulit sa doktor ninyo para pag-usapan po ninyo yung tungkol sa sinasabi namin neuropathy. Isa po ito sa mga complications ng diabetes. Kaya yun yung nararamdaman ninyong pagmamanhid, parang nagtutusok-tusok, neuropathy din po yun. Dahil po yung ugat, naapektuhan po. Kasi tatandaan nyo po, yung mga ugat po ninyo, may daluyan din po ng dugo yan. So pagka nabara po yung daluyan ng dugo, dun po pumapasok yung neuropathy. Po. Kaya yung sa paggagamot po ninyo, yung madami kayong gamot, baka kailangan lang pong i-adjust yung mga gamot po ninyo, kaya kailangan nyo po bumalik sa doktor po ninyo.
At saka nanay, very special case po yung sa inyo dahil meron kayong ischemia sa heart. Iba po ang paggagamot natin sa isang diabetiko na may komplikasyon sa puso kumpara sa isang walang komplikasyon sa puso. So maganda hong bumalik kayo sa doktor nyo. Yung pagtimpla po ng gamot, kailangan pong siguraduhin nating tama. Yung pag-fluctuate po ng blood sugar nyo, lalo na po ngayon magki-Christmas season, alam nyo po ba na pwede ho tayong kumain up to 6 times in a day. Ang importante lang, gaano karami bawat kakainin natin at yung pagitan ay dapat pare-pareho upang hindi masyadong aakyat ang blood sugar, hindi rin po masyadong biglang babagsak na pwedeng ikasama ng inyong complication sa heart. Pag masyado rin pong mababa ang ating blood sugar.
Okay, thank you, Doctor. So, iba rin ang treatment, no? It's a case-to-case basis. This one with Lydia, neuropathy and may complications sa heart. So, she has to see her doctor, her team of doctors again. Doctors, how about the treatment and medications that should be administered or should be taken for those who have type 1 diabetes? Let's start with type 1 diabetes.
Type 1, there is no other medication but insulin. So, they have to inject their insulin on time and eat on time. That's very important. They have to eat on time. They have to know the nature of their insulin because there are certain insulins that you have to wait 30 minutes before a meal. You inject, then after 30 minutes, you eat. And there are certain insulins that after injection, you can eat immediately. So you have to talk with your doctors what kind of insulin you're taking. So then you have to factor in the timing of your food intake because that's very important to avoid complications of hypoglycemia, meaning the sudden drop in your blood sugar. And for the oral medications, for the type 2 diabetes, again, the same principle. If you're on insulin, timing of meals and your insulin. And with your oral medications, you really have to know also when to take your medicines.
Okay.
And then, again, injection, and again, proper meal timing.
And gestational diabetes?
Gestational diabetes, basically it's diet and exercise. And if they need insulin, again, we have to emphasize timing of meals and your medications.
Okay, so doctors, we have come to the end of the show, but before we let you go, we'd like a final message. I wrote on my cue cards, diabetes education. So maybe the final word can be on that. Dr. Duran?
Okay. So to all the patients with diabetes, we are here to help you. We are like your life coach. We can guide you and coach you to manage your diabetes. It's very important you get a very good team, a diabetes specialist, a nutritionist, and a nurse educator. All of us can help you achieve your goals in life so that you will lead a life as if you're not diabetic.
Thank you very much, Dr. Duran. Dr. De La Rosa.
Education is already a part of our therapeutic management of diabetes because we want our patients to understand what their illness is and how can they have good quality of life. And they can live longer, even up to 100 years old.
Wow. That's a long time.
It's a long time to have
Quality
diabetes.
of life.
Quality
Again,
of
it's not
life.
in the numbers, but the quality of
Yes.
life. Thank you very much, doctors, for educating all of us on diabetes. And you know, a lot of those who have been diagnosed with diabetes and family members are afraid. But if you understand it, you address it properly, you catch it early on, then there's nothing to be afraid of.
Yes.
Thank you once again to Dr. Cedes de la Rosa and Dr. Melanie Duran for enlightening all of us on our topic for tonight, which is diabetes. See you again next Tuesday on MedTalk, 7 p.m. on your scheduled on-air consultation here on the Solar News Channel. This is Angel Jacob. Good night.
MedTalk would like to thank ATC Healthcare International Corporation, your trusted life ally.